Hi, everyone. My name is Dave Williams with 843 Benefits and Health Marketplace. And I just wanted to record this quick video to help all of our clients here at 843 Benefits walk through Employee Navigator for the first time. We're converting a lot of groups from some other older systems or jumping onto a system for the first time. And just want to provide a short little walkthrough to help everybody get this done. From the 843 Benefits website, if you click the client login links, you'll have an Employee Navigator login right here. Through our communications, we'll also have direct links right to the Employee Navigator homepage, which can be found at employeenavigator.com. So it's not too complicated. Once you go there, you'll get into your employee page once you're logged in. And I'll use this page to kind of walk through and show you what an enrollment looks like. This test case we've already done one time, and so we've got make changes instead of start enrollment, but it's going to go through the same process. When you see this first page, you're just going to want to make sure all of your basic information is correct because Employee Navigator will send this out to all the carriers. And if you're not getting cards or not getting information, it's probably because it's incorrect here. It's also important to check dates of birth as well because that's often one of the biggest reasons you can't be found in a carrier system. As you go through this as well, we've got an address listed. I moved a little picture there so you can confirm the address is correct. You'll save and move on from there. A lot of times it'll check with it'll check the address to make sure it's a registered address that can be verified. Under dependents, you also have the ability to make sure everybody's dates of birth and socials are listed there as well. And if you need to add anybody, you can click the add dependent link, and you can also edit and remove dependents as well. And when you get into the actual benefits, you'll have the ability to see whatever plans are available to the group. This particular company that we're using as an example provides 100% coverage for a base level plan and then allows the employees to buy up to one of two other gold level options. But again, you can choose your benefits on if you want it to be everybody in the family or just yourself and child, whatever you want to do. And you'll see the rates change per pay period based on whatever elections you make. So that's all built in there to try and make things nice and easy to be able to compare. You can do the same thing by clicking the comparison link. That'll pull all three plans up side by side, show you the cost, deductibles, out-of-pocket expenses. And then you also have resources over here on the right, which is the actual SBC for those plans. So if we click on that, it'll pull up the kind of the federally regulated document that is supposed to look the same for all different plans, showing you what the deductibles and out-of-pockets and copays and things like that would be. But again, whatever you choose, you'll have the option to choose your plan. And then you'll click Save and Continue to move on from there. If you didn't want it, you'll want to click the Don't Want the Benefit and list a reason. And it's important to list a reason just because it helps us when it comes time to requoting a group to make sure everybody's the participation requirements are met by other carriers as well. So sometimes it's helpful to know where your other insurance is coming from if you don't need the employer paid coverage. When you're getting into dental, again, same kind of thing. You have the ability to change who you want. Elect what you want for coverage for everybody, for example, and you'll see your rate change for pay period. And you'll just click Save and Continue from there. I'm going to go through the rest of these just a little quicker, just for the sake of going through a fast walkthrough here. We have vision plans and some other options as well, and we're just going to keep those the same. We have short-term disability. You can click on details as well to get into the specifics of when those benefits start, how long they last, and how much you're getting per paycheck. Normally the checks you're getting on short-term disability come in on a weekly basis. So whatever amount you see there is a weekly benefit amount. The nice thing about the voluntary life as well is that with these slider scales, you can change the benefit amount and you'll see that we go from 50,000 to 80,000. All of a sudden it's letting us know we're not approved for that amount yet. So if we were to take a higher benefit amount, let's just say $100,000 in this case, we have $50,000 that's guaranteed issue, and then another $50,000 that's pending a health insurance review. So when you click Save and Continue on that, you're going to get this little notice saying that you need to complete an evidence of insurability form. That'll get generated normally by the carrier, and if not, your health insurance agency can provide this to you as well. But you get through that. You can also verify your beneficiaries, making sure that's accurate. Just in case something were to happen, it's good to have all this stuff on file, and you can come in and change this at any time. So if you have life events or anybody new in your family that you want to change the beneficiary for, you can do that very easily. We also sell accident and critical illness plans to this group. Accident is honestly one of my favorite plans just because for most of us, accidents are why we end up at the doctor's office. And this plan pays kind of like you see on commercial with the Aflac Duck. It pays you out directly based on whatever kind of injuries you might have had or who you might have seen, whether you had x-rays or went to the ER, all that kind of good stuff. So that's a fun benefit to have as well. I'll work on through the last one. We got critical illness, which is kind of like a cancer policy. And then when you get to the end with the signatures, it's a very simple process. You'll click to sign the bottom. You can scroll down to see your review of the plans you have. And then you'll also see your cost per pay period with all the plans involved and all the contributions from the employer. And then you'll also see the dependent list. And this is important to make sure that you did enroll the dependents the way you wanted to, so that when you're taking your kids to see the dentist, you make sure that they are on your plan. But again, you can make sure you're covered the way you want to. In this case, we can say we have accident coverage on the spouse and not the kids. And if you needed to change that, you can just go right back up to the top, click on the view step section, say go back to the accident, click here, come back in again and realize you didn't select all for that. So you can go ahead and fix that right there, click save. And then again, you can get back through the rest of this and finish things off. So you can go to the view steps part and get all the way to the end, or you can go through the other benefits either way. Now we're back on the signature page again. We'll click to sign off. And then that lets us know that we are acknowledged and we have a submitted enrollment for benefits. And that is really all you need to do. Anytime you want to come back and check your benefits for the year, you can do so. You can look at your cost per pay period, look at benefit summaries and make changes based on life events. It's really a very easy system to use, and hopefully we can get more folks on it this year as well. So hopefully that's a helpful tutorial for you, whether you're an 843 benefits client or not. We'll put this out there to try and be educational for everybody. So thanks for paying attention, and we will talk to you later.